Hey warriors, here's our fifth lesson for therapy. Here we're going to focus on behavior therapy. And behavior therapy, we're focusing on behavior modification. We see something that is deviant, distressful, dysfunctional, and the other D. And we want to help people develop more adaptive behavior. Behavior that fits their lifestyle more readily. Some people seek behavior therapy to eliminate undesirable behavior like overeating, smoking. Others seek behavior therapy to acquire desirable behaviors like the skills needed to develop a healthy lifestyle or healthy social relationships and confront phobias. So we have seen some of these in the past. Behaviorists believe that both desirable and undesirable behaviors are largely learned, and that people that have psychological problems have learned unhealthy ways of behaving, and it's reasonable for us to think that we can unlearn bad behaviors or healthier ways of behaving. So for behaviorists, the reason for undesirable behavior, it's not important. It doesn't matter what we're thinking about it, but changing behavior is what matters. So the goal is to eliminate unwanted behavior or to acquire newly desirable behavior. Behavioral modification takes the form of two things, and that's counter conditioning. That helps us to unlearn the undesirable behaviors, like think of Pavlov's dog in classical conditioning, and operant conditioning, which helps us learn more desirable behaviors. The choice of behavioral techniques for an individual client depends upon the nature of the individual's disorders. So whether or not we're going to use positive reinforcement, negative reinforcement, or something called aversive conditioning depends on the behavior itself. All right, so let's talk about counter conditioning. Counter conditioning is used if undesirable behaviors are conditioned or learned through reinforcement. Then we can unlearn it, or we can counter condition it. Counter conditioning pairs the stimulus that triggers the unwanted behavior, like a fear of spiders, with a new and more desirable behavior. For example, a client who reacts with fear to spiders can be counter conditioned to respond to spiders in a relaxed manner instead. Counter conditioning techniques include systematic desensitization, modeling, and aversive conditioning. All right, we'll start with systematic desensitization. This was developed by a man named Joseph Walp in the 1950s as a treatment for phobias and for other anxiety disorders. The assumption with systematic desensitization is that a person cannot feel anxious and relaxed at the same time, and so the therapist is going to train the client to relax in the presence of the anxiety-producing stimulus. This is done in a systematic way. So it goes through steps. Step 1, therapist teaches the client how to relax completely. Step 2, the therapist asks the client to imagine snakes until anxiety while practicing the relaxation techniques, and then repeat. Step 3, they're going to show pictures of the snakes while using the same techniques. Relax, work through the fear while you continue to relax. And then lastly, they may be given a toy snake or even shown real snakes from a distance. And then after that, more snakes are brought more close so that they can combat the feelings of anxiety with relaxation. Systematic desensitization can be combined with other counter conditioning measures like modeling and aversive conditioning. Modeling involves observational learning, and the client observes and then imitates the therapist or another person coping with the feared object of the stimulus. For the person who fears the snakes, the therapist might ask the person to observe calmly watching a snake slithering around, and then the client would be encouraged to behave the same way. So the key is just relaxing when you're exposed to the fear-inducing stimulus, and think of the thing that produces the fear, relax. Gradually, the person might be shown pictures, then they're moved closer to the thing that produces the fear. In modeling, the client observes and imitates a therapist's behavior or someone else with a phobia. For fear of snakes or bugs, a person may observe someone calmly watching a snake slither through the grass, and then the client would be encouraged to behave the same way. With aversive conditioning, the goal is to extinguish undesirable behavior. It's almost the opposite of systematic desensitization. In aversive conditioning, the therapist replaces a positive response to a stimulus with a negative response. For example, if a person wants to stop smoking, the therapist might replace the pleasant feelings that are associated with smoking with unpleasant ones. The person who may be asked to smoke several cigarettes at once through a device that holds 2 or more cigarettes, and this exposure to the cigarette smoke makes smoking unpleasant and gross. With repetition, the person may come to avoid smoking. Think of if you're a nail biter, they put that nasty nail polish on your fingers, and then when you go to bite them, it's not rewarding. Alcoholics with aversive conditioning, alcoholics can be given medication that makes them throw up when they drink. So they take a drink and they're vomiting. The problem with this, though, is that we can override, your brain is very powerful, and we can override those things that make us sick. If we really want that drink, then I can fight through that. But people who learn more desirable behaviors through counter conditioning experience a boost in self-esteem as well, because they beat the thing that created the problems. By confronting and challenging and overcoming these fears, people will increase their opportunity to live less restrictive lives. So it's a win-win. Operant conditioning is used as a behavioral technique that's based on the assumption that behavior that's reinforced will be repeated, and behavior that's not reinforced will be extinguished. So behavioral therapists reinforce desirable behaviors with rewards, and at the same time, don't reinforce the ones that we don't want. The rewards for desirable behavior might be praise or treats, depending on the setting. Operant conditioning has sometimes proved effective in severe cases like schizophrenia and autism, which have previously been resistant to treatment. Some operant conditioning techniques that you see on a regular basis is a token economy. We use token economy in schools. They're used in prisons. They're used in institutions because you get a reward, and then you can use this reward for other things like free time, snacks, extra time, a trip, private time. So that's why you got a prisoner with a stake there. You can use good behavior for other things. An example at a mental hospital. So the staff at one mental hospital used operant conditioning to convince withdrawn schizophrenic patients to eat their meals. The more the staff coaxed the patients to eat, sometimes even hand feeding them, the worse the problem became. So the extra attention from the staff was apparently reinforcing the patient's lack of cooperation, and the greater the refusal to eat, the more attention they got. So the solution was to stop reinforcing the uncooperative behavior and instead reinforce cooperative behavior. Patients who arrived late at the dining hall were just locked out. Hospital staff were prevented from helping patients at mealtime. Thus, uncooperative behavior was no longer rewarded and no extra attention given, and only those who cooperated received food. As a result, uncooperative patients quickly changed their eating habits. Another thing we do is successive approximations, and that's when we reinforce little steps along to the goal. So completing a circle was one thing that you saw B.F. Skinner do with a pigeon in the operant chamber. So successive approximations is when we get close to the reward or the goal that we want, and we reward that behavior. Here's where you can use that. If you want to increase your study time to, say, 2 hours a day, but studying longer hurts our concentration. So we want to go 15-minute increments. And before we know it, we're going to reach that 2-hour goal. 2 hours straight of studying is a lot. I wouldn't recommend it. Do 15-minute increments. It's much easier to manage. One more thing that we can do with operant conditioning is modeling and practicing social skills. Think of job interviews or something. You can practice a job interview. And if you lack social skills for these things, modeling and practicing allows people with psychological disorders to live in society, to hold down a job, to live on their own. So behavior therapists can build social skills, advising clients on their behavior, modeling effective strategies and effective behaviors. This helps us build our skills and encourage practicing effective techniques. Now, ultimately, does this stuff work? It does. It's a short-term therapy that will introduce more immediate results, and the results usually last. Behavior therapy is especially effective for well-defined problems like phobias, PTSD, and compulsions. has also helped many people overcome depression, social problems, problems with self-control, like drinking, smoking. And in addition, behavior therapy has proved very useful for managing the care of people living in institutions, especially those with more severe behaviors. It may not be as effective as, say, cognitive behavioral therapy for things like depression, but it does get results. That's it for this lesson. One more to go.